Welcome to the DC Perinatal Voices podcast, hosted by the DC Perinatal Quality Collaborative, where we spotlight members of our community and healthcare partners who are working every day to improve maternal and infant health outcomes across the district. I'm your host, Yolette Gray, Senior Director of the Maternal and Child Health Initiative over the DCPQC. Today, I'm excited to be joined by Nephthalie Smith, midwife, practicing at Cedar Hill Regional Medical Center. Nephthalie works closely with patients and care teams to provide compassionate, patient-centered maternity care and brings a unique perspective to supporting families throughout pregnancy and birth. Nephthalie, thank you so much for being here today. How are you doing?
I'm doing great. Thank you so much for having me on.
We're really grateful you could take the time to join us. To start us off, I'd love to go back to the beginning. Can you tell us about your journey into midwifery and what inspired you to pursue this path?
Yeah, definitely. So initially, my journey started with nursing. I was a bedside nurse in labor and delivery. I worked in public health. It was just always women's health, no matter what. So at some point, I decided I really was driven by my desire to return the human aspect to the center of healthcare. So midwifery was the way I wanted to do that. So I transitioned from labor and delivery to becoming a midwife and now pursuing my doctorate as a terminal degree. But I realized that my passion really lies with the just wanting to see clinical excellence meet patient advocacy, right? So kind of marrying the labor and delivery and midwifery. So for me, midwifery is just more than just catching babies. It's about empowering our families and giving them support through their most life-changing moments.
Thank you for sharing that. That kind of passion really comes through in this work, going from nursing to midwifery. Let's bring the listeners into your world a bit. What does a typical day or shift look like for you? And what are the moments that really stays with you?
Yes. Wow. Every day is different, that's for sure. So, a typical shift, it might start with my morning in clinic, for example, having, maybe a 30-minute conversation about nutrition or mental health or teaching a new mom what to expect. Just calming her nerves. And then I might end up spending my evening in a hospital navigating high pace, high energy environment of labor delivery and delivering babies back to back all night. So that just differs from day to day truly, which I love. That's the exciting part. The moments that stand out aren't honestly the big ones. It's really those quiet moments after a baby's first born and everything kind of goes still in the room and the parent realizes, hey, I did this. The mother is empowered by watching her baby. And those moments are really just pure, unfiltered human connection, right? That's really what sticks.
Yeah, it does sound exciting. I'm sure bringing new life into the world. You've given us such a great window into the day to day. When you think about your role as a midwife, how do you describe the impact you have on patient and families?
As a midwife, I do see myself primarily as a navigator, but I can also wear many hats as support as well to a woman. My job as a midwife is to guide patients through the healthcare system, right? Ensuring that they're not just processed as a number, but really truly heard. So the impact in the autonomy we give back to our patients, when a person feels like they're an active participant in their care, the clinical outcomes actually improve. But more importantly, the experience of becoming a parent is transformed from something just happening to them and rather something that is led by them, right? And so that's really our job as midwives.
That's so good to hear because we do have patients and they do want to be heard. And so hearing you saying that the patient want to be heard and how you listening to the patient really does make a difference. One thing that often comes up is how different care models work together. How does midwifery care differ from traditional obstetric care, and how do those approaches complement each other?
So actually, this is a very, very common question. So our philosophy as midwives is rooted in the belief that pregnancy and birth are a normal physiologic process, right? A healthy life experience for most people in most cases. Midwives prioritize low intervention, evidence based care, but we also use the holistic approach, and that's probably from our basis of as being nurses, to include the mind and the spirit of the patient as well. So we don't just treat a pregnancy, we care for the person within the context of their family and their community and how those things affect their health overall.
So good to know. So good to know. But, I imagine there are still some misconceptions out there. What do you wish more people, patients, or even other providers better understood about midwives?
Yeah, actually, it is, although midwives have existed for since the beginning of time, folks still don't have a clear understanding of what we do. So the primary difference is often in the model of care. So obstetricians, which they are brilliantly trained surgeons and high risk specialists. However, the difference is midwives are experts in physiologic normal process of birth, right? And depending on your setting, sometimes beyond that. So the two complement each other really. When we work together, obstetrician midwives, the patients get the best of both worlds. So they get the personalized, time sensitive, supportive midwife with the specialized surgical backup of an OBGYN should something unexpected happen. So it shouldn't really be a either or situation. It's just part of the continuum of care.
For sure, it is. And for those listening who may be preparing for birth, what advice would you give to expecting mothers or families as they get ready for this experience?
Sure. So, my biggest piece of advice is to trust your intuition and to build your village and community around you for support. So, birth is as much a mental and emotional event as much as it is a physical one. So, surrounding yourself with care team, making you feel safe enough to ask those questions that you often, might defer to Google. And remember that you're not just preparing for the big day, the birth, essentially, but you're preparing for a lifetime of parenthood. So just be kind to yourself, give yourself grace, and trust the process.
Such great advice. It also helped them feel more confident and empowered. So
Yes.
truly appreciate that advice to our
Absolutely.
audience. Neftali, is there anything else you would like to share that we didn't cover?
Um, yeah, so I just want everyone to understand that midwives are part of the team-based approach with making sure that we have the best outcome for our DC moms. And so we want to ensure that even in a high-risk scenario, that the patient's care remains patient-centered, right? And that's really the objective of just midwives and how they can contribute to the outcome and the safety of your care.
Yes. Thank you so much, Neftali, for sharing your experience and insight with us today. And thank you to our listeners for tuning in to the DC Perinatal Voices podcast. To learn more about the DCPQC, visit us at dcpqc.org and be sure to follow us on Instagram, Facebook, and LinkedIn. Until next time, stay well and stay connected.